Hello, everyone. I'm Frank Garza with Lean Startup Company, and it's my pleasure to welcome you to the webcast. Today's topic is how the startup Vivid Vision is changing the world of optometry. And moderating the discussion is our own Lean Startup Company faculty member, Hisham Ibrahim. Our guest is founder and CEO of Vivid Vision, James Blaha. And with that, I'll hand things off to Hisham.
Hello, James.
Hi, thanks for having me on.
Thank you for being with us. I'm really excited to talk to you today. The field of healthcare and healthcare technology and innovation is something that I, as well as many others that I know, are really interested in. So looking forward to learning from you in this conversation. So why don't we start with that? Why don't you describe to us, what does the landscape of health tech look like today?
I think it's a pretty interesting time to be working in health tech. I think a lot of consumer technologies are now being applied into healthcare a few years, after they've been applied outside of healthcare. So we're seeing a lot more, phone apps and VR applications in medicine, and we're also starting to see some AR stuff. But I think that sort of goes across technology. There's lots and lots of what used to be just consumer technologies being applied in healthcare.
And that's really interesting. What do you think that has enabled or empowered entrepreneurs to be able to do in solving problems?
I think the biggest thing is that we can solve some of these problems a lot more cost effectively than was possible with specialized hardware. So consumer hardware has the benefit that since it's so high volume, the costs are pretty low per unit. Versus what's typical in health tech is that there are it's so low volume that specialized hardware is extremely expensive, even if sort of the consumer equivalent of that hardware would be very cheap. And we've been able to sort of take advantage of that in VR. The reason VR headsets are so cheap is because they're expecting to sell a lot of them for people to play games. But we can use the exact same hardware for medical applications, and we sort of benefit from that cost reduction and from the volume.
And do you have a favorite new health app other than yourself, of course? Do you have a favorite new health app or something interesting out there that really solves an important problem for consumers in healthcare in a new and innovative way?
There are a couple. I think within healthcare and virtual reality, some of the most interesting companies are pain management systems. And so there's a few companies doing this where basically if you distract a person enough or sort of separate what they're seeing and hearing from the pain they're experiencing in the moment, you can reduce their pain by quite a lot. Some of the studies are saying it's as effective as morphine without the morphine. So I think this line of investigation is pretty interesting because you might be able to control or give people control over their own pain, as well as other things that could affect their mood and their health.
Which then takes us to you and how you got started. So what inspired you to start Vivid Vision? How did it all start?
So I grew up with a lazy eye. I had to wear an eye patch growing up over my good eye. So the idea is to cover up the good eye to force the kid to use their weaker eye more, so their brain learns how to use it. So when I was young, I was about 9 when they told me I was too old to continue treatment and that I wouldn't be able to use my weaker eye and I wouldn't have depth perception. And so flash forward to now, almost 5 years ago, when the first Oculus Rift came out. And a few years before that, I saw a TED Talk by a woman named Sue Berry, who gained 3D vision as an adult, who also has a lazy eye. And so that's sort of that, and this new VR hardware. I sort of had this idea to use this new cheaper hardware to implement some of the stuff that she had talked about and some of the stuff I had read online. And my first prototype that I made, I'm a programmer. My first prototype I made, I ended up seeing in 3D for the first time. So that's when I sort of dropped everything else I was doing, and I put a little more work into that. I put a crowdfunding campaign up, ended up raising more than I expected through the crowdfunding campaign, and that's sort of when I discovered how many people have lazy eye. And then that's sort of what kickstarted the business.
How long ago was that?
That was almost 5 years ago.
Wow, so you've been focused on this for 5 years. So tell us about that first prototype and that crowdfunding campaign. What it sounded like you were surprised with how many people have lazy eye that were receptive to the idea. I'm curious about what were your first couple of really big leap of faith assumptions going in? How did they prove out? How did you test them?
Well, at first I never really intended for it to become a business. I was just sort of experimenting, playing around. Initially I had this idea that first I'd just try to measure what was going on. And then as I heard this Sue Berry's TED Talk, and I read more of the literature, I realized it might be possible to treat it too. And then, I had better results for myself than I was expecting to have, which sort of, prompted me to do a lot more research. I think once I decided that, I was actually going to pursue this as a company, the biggest leap of faith was that what worked for me would work for other people too. Lazy eye is really 3 different conditions, and people have, sometimes it's just one of the 3 or 2 of the 3 or all 3. And so the symptoms vary quite a lot. No 2 people are exactly the same. And so it wasn't obvious at the time that just because it worked for me, it would work for most other people too.
So with that's a pretty big assumption if you're starting a business based on this. How did you go about testing this without going fully into it and commercializing the product? How did you answer that question?
Well, the crowdfunding backers were the biggest help there. So, we had 500 people back our crowdfunding campaign. Once we released the first version of the software, about 200 people with lazy eye actually used it and sort of reported back to us how things were going. Mm-hmm. The biggest thing we learned from that was that people don't have a very clear idea exactly what's going on with their vision. And that's what sort of prompted us to move away from the sort of direct to patient, direct to consumer route, and instead work through doctors.
Got it. Which is a whole other ballgame, because now you have another kind of customer, the eye doctors, and I'd imagine there's a big foundational assumption there that they're willing to take on a new technology like this that potentially maybe disrupts their own business.
Yeah, I think there's concern from eye doctors, and I'm sure this is true in other industries. When a company is working on a new technology, new medical technology, they're afraid of automation generally. Mm-hmm. They're not extremely tech savvy, but there was also this feeling that most of the optometrists I talked to expressed this idea that they had been expecting better technology for some time and no one had really delivered on that. And so I think there was this desire for better tools from optometrists that we sort of stumbled into. And certainly some optometrists are sort of afraid of new technology, but they were just as excited about new technology, or at least there were just as many afraid as excited.
Mm-hmm. What is it that you had to prove out with them? Is it the business model, or how did you go about this? I assume there was some business model questions.
Yeah, the first concern is always, does it work? Will it help my patients? And if you can address that, then you also have to answer, how will it make them money? How will it help their business? Because ultimately, all of our customers are small business owners. In the US, 60% of optometrists are independently owned and have less than 10 employees.
Mm-hmm.
So, they're making decisions as a small business, and they have limited money for new equipment. And so, they can't make an investment in new equipment without an understanding of how it's going to help their business. But, patient outcomes are a necessary first step. So if they don't believe it's going to help the patient, doesn't matter how much it costs or how much it'll make them, at least, for most optometrists. So the key is really first convincing them it works, and then second, showing them sort of how we can work together so that we're both successful.
Mm-hmm. So how did that go? Like with the first handful of these independent optometrists, how did it go?
We gave, or we actually sold that, but at a much lower cost than we would later sell it for. So the first few we sold, like the first one we sold, it was like 2, or it would be equivalent to like 3 for the price of 1 today. But they got 2 units and they used it, and they gave us a bunch of feedback. So the first people who used it, they got a really good deal. But they also gave us a lot of really, really valuable feedback. And we actually, in that first 6 to 8 months of testing, we had, I think, 3 or 4 clinics using it. After that 6 to 8 months, we basically totally changed the interface. We realized that the way they use it in their practice was very, very different than our initial vision that sort of we as programmers, I guess programmers plus patients put together. We really had to sort of hear the doctor perspective and how they work with their patients day to day and things like that to redesign it.
And what is it? Like, what do they actually get? You mentioned units. What is it that they're paying for?
So we sell the doctor a computer, a VR headset, and the software. And then, we are now our clinical team. So we have 2 optometrists and 2 vision therapists full-time, who, once the doctor gets set up with the system, they'll walk them through setup and training online, through video chat and remote desktop control.
Mm-hmm. Got it. Now, I have to imagine that in the medical field, the idea of breaking things, experimenting rapidly, learning, failing, and iterating is something that's not easy. How do you go about that generally? Like how do you break things safely? How do you experiment on a regular basis?
It's become harder the more established we've been. So I think it was a very similar process to what a normal software startup, the normal experience early on. Before we released a product, we could build things quickly, we could break things, we could test stuff out. When we had just a handful of clinics, we told them this is beta software, it's still under development, there's gonna, be issues. And so we could change things very quickly then too. Now things have slowed down a little bit. Once people, have sort of worked it into their day-to-day treatment, you can't just change things overnight without telling people. And you also can't easily just, as easily release patches that have bugs in them and sort of use the customers to help test it. And so now, we have a lot more thorough quality control that requires lots of documentation and sign-offs, and there's requirements for the software we're making, because now we have approvals in Europe and in the US and in Australia, and each country that we've gotten regulatory approvals in has added slightly different requirements and documentation and quality control. And so I think now we try not to break things very much, at least for the product that's currently in use in clinics. But we do have a group, maybe less than 5 to 10% of our customers who were the original early adopters, who have had it a long time, and we'll send them beta builds and ask for their feedback, previous to releasing it to everyone else. And that, in that correct context of saying, this is a test build, it's experimental, there's some features that are brand new that we've never really tried before, we just want to get your feedback, then they'll try it out, not with patients at first, give us that feedback, and then we'll incorporate that before, doing a wider release to everybody.
Got it. So you've got a group of kind of willing early adopters who are willing to look at early beta features and give you feedback on them. How about when it comes to like your hypotheses around the growth or the business model? Are you still iterating on that, or is it pretty set now and you're just focused on improving the product?
We are still iterating on that. We've tried a lot of different things, and I think it's still not clear exactly what the best way to sort of deliver everything is, because we have right now, we actually have two products. So one is the clinical version, which we sell to doctors to use in their office to treat patients coming into their clinic. And then we also have a home version that uses less expensive hardware and can be prescribed by an eye doctor to use at home. And so there's lots of questions about sort of, for this home version, the delivery of the hardware. Is the patient buying stuff from us, or are they buying stuff from the doctor? What's, sort of the doctor's role and level of work when setting up a new patient? There's a lot of questions because it's, we have two customers and they're both sort of, they're both really important to us, but they have very different needs from each other. And so there's often decisions where, if you make one decision, it's best for the doctors. And if you make a different decision, it's best for the patients. And it's hard to sort of balance that.
Mm-hmm. Are you thinking then about any specific experiments to help you answer those questions before you actually make final decisions around the business model, or how to sell, or how to balance those needs?
Yeah, I think we've been a little atypical in that we've moved pretty quickly in becoming established in other countries. And one of the benefits of that has been that we've been able to test different models in different countries.
Oh, okay.
So, things work a little different in Europe than they do in the US. And things are, different in Australia than both the Europe and the US. And so we'll often, try slightly different things in our different markets, and, try to figure out what's best. And a lot of times decisions that were made in one market, work their way over to the US or vice versa.
Mm-hmm. Mm-hmm. Very good. Now, let's talk about failure, because we love cheap failures that eventually lead to success. Has that happened to you? Do you have something where you just, it just didn't work out the way you expected it to work out. And what did you learn from it?
Yeah, I think we've had a lot of failures over the last 5 years. I think we've learned from most of them. One example is early on the crowdfunding campaign and sending software out directly to people. We knew people really wanted to just buy it directly and not involve a doctor. But so many of the stories we got back, it just became apparent that people had sort of misdiagnosed themselves or didn't have quite the right understanding of what their eye problem was. And these things are sort of complicated enough where if you get some of these things wrong when you're configuring the software, the most likely situation is the person won't improve, but there's a small chance their vision could actually get worse if it's misconfigured. And so, that first sending out that first software to the backers directly, I think was the first sort of major failure. I mean, we were really planning to just sell a game to people is how we sort of thought of it back then. And then we sort of, I think we were a little naive about the complexities of treating this problem. And so, what we learned from that failure was, that this is a complicated thing, that doctors are involved in making decisions about this for a reason, not just because it's good for doctors. And we sort of addressed it by really switching the whole goal of the business over to making tools for doctors rather than making software, for patients directly.
Now, in hindsight, given what you've learned, is there something you would do differently in how you've established and run the business in the last 5 years? To do it again.
I mean, I would have done the crowdfunding campaign significantly differently based on what I know today. I think under one lens, the crowdfunding campaign was a success. It put into, or it made happen everything that has happened since then that has got us to where we are today. But if I could do it over again, I think we could have raised 5 to 10 times more pretty easily. And there were just a few mistakes that sort of added up it was still successful, but I think it could have been a lot more successful if I had waited a little bit and just, changed a few things about the crowdfunding campaign.
What's one thing you would have changed to make it more successful?
One thing was the amount. So the first 100 people got the software for $10 each, and most of those people spent $400 on a headset immediately after, only to use our software. The next 200 people got it for $20, and we raised $20,000 from 500 people.
Got it. So your price was low.
Yeah, I think that was one of the big things. And I think people would have been happy to pay $50 or $100 when we know they were spending $300 or $400 on the hardware. And we weren't really lowering people's price by all that much by making it $10 because they had to go spend several hundred on the hardware. So I think, we could have increased their overall price by, 20% or something like that. And we would have raised 5 to 10 times more, which would have made it, given us a lot more resources early on. And we wouldn't have had to, go straight to fundraising from other sources as quickly. I think it would have given us more time to figure some stuff out before, having to raise money.
Got it. Now, James, as the CEO of the startup, it sounds like you've got an experimentation mindset. You've got a let's build something quickly, put it out there and learn from it. What are you doing, or what have you done as the CEO, as the leader of the startup with your staff to embed this mentality in the company?
Thanks. Yeah, it's interesting. I think a lot of our employees are sort of startup-minded people. Especially, I guess more so the developers and the people in the Bay Area. But we also, about a third of our company are clinical, so optometrists, vision therapists, and the startup mindset is not well known to clinicians and medical industry people. And so there has been sort of we're trying to find a happy middle ground between being like a startup and being like a doctor. And I think doctors are, and not just doctors, but sort of health industry people, professionals. They tend to be more, significantly more conservative in taking risks than startup people, which is probably a good thing. Like, we probably want our doctors to take fewer risks than startups do when they're helping us with our health. And so we've been trying to sort of consciously balance these two things, where we still want to move fast, we still want to break things, we want to experiment, we want to figure out what's right by, testing it out in the world. But at the same time, we want to move carefully and consciously and make sure we don't make mistakes that might hurt people.
In a way, you balance each other out?
I think so, yeah. I think, we're both pushing the other one a little bit it has this moderating effect, which I think is good.
That is good. And then finally, I want to ask you about, like, what piece of advice would you have for fellow entrepreneurs, and maybe more specifically entrepreneurs in the health tech sector, based on your experience so far?
The biggest thing that surprised me, when we started working, it was not difficult for us to find university collaborators to do research with. People in academia and in medicine, they need programmers and entrepreneurs more than the other way around. And that's not to sort of devalue the researchers' work or anything like that, but there's all these researchers who want to see their ideas go into use in the real world. And it takes business knowledge as well as technical knowledge, as well as the expert medical knowledge in order to do that. And there's lots and lots of people at these universities who will work with entrepreneurs to translate their research into products that actually reach people. And so the sort of advice I would give in health tech is, if a lot of people don't do it because they think that it's difficult, and they think that without the medical experience they shouldn't get into it. But I don't think that's true. I think people with business and technical skills are really needed in medicine, that stuff can be learned more quickly than people think it can.
I love that advice. Thank you, James. I really appreciate it. Is there anything that I didn't ask you about that you'd love to share? We pretty much covered the basis.
Yeah, I think we covered most of it.
Excellent. Well, thank you again. Really appreciate your insights, sharing your experience, and your time. Thank you, James.
Yep. Thanks for having me. It was nice talking to you.